Good afternoon, everyone. It is 12 o'clock, so we are going to get started. My name is Nicole Pound, and I'm with the Pennsylvania Coalition for Oral Health, and I'm delighted to welcome you to our webinar today on connecting students to oral health careers and working to inspire the next generation of dental professionals. Before we give in a few housekeeping notes, please remember to keep microphones muted to minimize any background noise. Also, if there will be time dedicated at the end of our presentations for discussion, so please make sure you're using the Q&A feature at the bottom of the screen. And we are going to be recording this webinar and sharing the slides after our presentation today. So I will be guiding you through today's session. And as you can see from the agenda, we are joined by speakers from two of Pennsylvania's area health education centers, who are going to be sharing their region's work on engaging students towards dental-oriented career pathways. But before we dig in, I do want to take the time to set the stage. And for any of you that may have been on a PCOH webinar in the past, you should recognize our Pennsylvania Oral Health Plan 2020-2030. This is the roadmap for the work that we do, especially when we're addressing the priority area of our oral health workforce. Now, like all other sectors of healthcare, Pennsylvania is facing a shortage of significant shortage for dental providers. And if we break down that by the numbers, what we know is that there are 1.6 million Pennsylvanians who are residing in areas of the state called a dental health professional shortage area, where they do not have access to dental care. We also know that it will take 4 times as many dental providers to fill these gaps when we're comparing that to primary care shortages or even mental health shortages. Now, you may have joined us for one of our previous workforce webinars where we looked at the variety of dental training programs that we have in the state. And we're very lucky that we do have a variety to choose from, because that gives us the opportunity to produce the next generation of dentists, hygienists, and assistants. So our goal today is to really explore how we are connecting or driving students into these programs and therefore into our oral health workforce. Now, before we hear from our speakers and their creative ideas on how they're driving students into these pathways, I wanted to explore what our Pennsylvania high school graduates are doing after graduation. Now, the Department of Education does put together a survey of the nearly 700 public schools and the average annual graduates, which is about 125,000 each year, to figure out what their plans are after graduation. And what you can see on the slide is that the traditional pathway of continuing your education after high school is the majority of our graduates' choice after. So 64.3 are reporting some type of post-secondary plan. Now, what about, that trending data? Has that been consistent? And what we can see over the past 5 years is that the majority of students do plan to pursue college or some type of specialized education. But what we also see is that that has also went down a little bit, and we're seeing students being more interested in looking at non-post-secondary options. So, it's very common for us to talk about education after high school, but we don't always consider what options there are after if you're not choosing something like a college or specialized training program. So for 35% of graduates that aren't reporting those plans, that could be entering the workforce, joining the military, or taking on something entrepreneurial. So there are a lot of options and a lot of decisions for our high school students to consider. And we know that these conversations and ideas start earlier than high school. They start at the middle school level, and maybe for some even earlier than that. So when we're talking about impacting the dental workforce, why is this important? I think it's important because this trending data helps us understand that generation. What are they interested in, and what type of choices are they making for their future? So to use that, we can make sure that we are talking to them based on what option they see for themselves or where they prefer to, follow that path, and help them understand that there is a dental career option no matter what they choose. So for instance, not all dental providers are required to earn a college degree. So if there's somebody who may be interested in a non-degree option, dental assisting, expanded function dental assisting, and community health work all present career opportunities that have lower barriers to entry while still offering a pathway to grow in the field. And I think that's really important when we're looking at how we connect with these students and start to have these conversations. So again, I just wanted to kind of set the stage of where we're at when we're talking about driving students towards careers. But I'm very excited for the our presentation focus, which is really highlighting how we can foster the interest of dental in our students. And I'm so happy that we are joined by our speakers, Susan Gage and Lynn Williams, who both work for different regions of our Pennsylvania Area Health Education Centers, or AHEC. And if you're not familiar with an AHEC, it is a program that offers opportunities and services to help individuals explore, or those individuals that are pursuing healthcare careers. So please welcome me in having Susan from our North Central Pennsylvania AHEC talk about what's going on in her region.
Hello, thank you for having me today. I'm the executive director of the North Central region, like Nicole said. North Central in Pennsylvania is not a term that has a standard definition. So the counties that I'm actually looking at are Center, Clinton, Columbia, Lycoming, Mifflin, Montour, Northumberland, Snyder, Tioga, and Union. Next slide, please. So when I go out and I talk about oral health careers, this is how I do this. This is how I set things up with either the middle school kids that I talk to or the high school kids. So I'm going to show you kind of how I set this up and then a couple of the different activities that I do. I start by asking them to name some oral health care professions just to see what they know. I've done this enough times to know that they are most likely going to tell me they know what a dental hygienist is. They know what a dentist is, sometimes an orthodontist. People do not know what a dental assistant is. They do not know what an EFTA is. So that is my next step. They don't know what they can't see or they haven't experienced. So that next step is I have slides for each career, and I explain to them, what the careers do, maybe if I can get local salary information, what that is, educational parts, what seems to be a huge ask request right now, something that the students really want to understand is they want to see if there is a career ladder, how many steps up they can take. So this is where oral health careers is great to speak about, because you can start by speaking about being a dental assistant and the education there, and they can start that without that college degree, like Nicole was saying, but they can pursue it to EFTA. And then, of course, you explain registered dental hygienist and what a public health dental hygienist practitioner is. And in a couple of my counties, we are employing them. Certainly it's a newer position for Pennsylvania, but our FQHCs, couple of them are really moving forward with that. So that's great to be able to explain all of those careers. And I'll show you a sample of a slide that I do in just a minute. And then I always bring handouts for the students. And I do this because all of us, even as adults, we need to hear things more than once before it really sticks in our minds. And so my hope when I do this with students is that, there's a parent or interested party at home that knows that their child is taking the day at school to do this. and that they ask questions and they have these handouts and can talk about it. So I make sure there's lots of contact information on that. And sometimes this last time I put a little welcome note for parents to reach out to me because they were not in the presentation. And I did have 2 parents reach out to me to ask more questions. And the handouts that I get are from the Pennsylvania Coalition of Oral Health. They have some amazing career handouts already made on their website. It's under their resource tab. So I don't recreate the wheel. I go right to them and get those lists right off their websites. The other thing that I found very useful that I've started doing, and again, I get this from PCOH, is they have list of Pennsylvania schools for each of the professions. And I found that really useful, particularly with the high school students who are a little closer to looking at career pathways and finding schools and where are these local, like, can I do it? Do I have to move the county? All those questions. PCOH has already put that together. So thank you for that. I do pass those out. And that seemed to be very helpful in the feedback that I got from this last round of high school students, that they will not have to go home and look that up themselves. Next slide, please. So this is an example of the slide that I was telling you about, of just what I do for dental assistant. It's very, very simple and straightforward, talking about the education, the major tasks that you do, the work environments that you may be in, and then if I can get local salary information, I prefer to share that if I can get something that's closer to a specific county. If I can't get that, then I will refer to the Pennsylvania salary range, but our state is very, very diverse and different. So depending on where you live, that salary range is going to be quite, wide. And so then I do reiterate again, that, there is a career ladder for the dental assistant, the next step up being the EFTA, really making sure that students hear more than once, here's different ways that you can move up within this field. Okay, so now I want to show you some of the activities that I do. So kind of the next slide. Okay, so this is one that we do with middle schoolers. Actually, one of my coworkers, Tom, does this most often because he has a background degree in middle school and high school science. And so he can really take this any way that the school would like him to do it. We're obviously there to cover everything career link related to this, but there again, sometimes he will go on and talk about connecting this, with the science, with bacteria in your body, in your mouth, and how that affects the rest of your body. And really look at the interest in the audience, really trying to connect the students who are with it with, what makes their eyes light up, really paying attention to that, because we want them interested. We want them to know, oh, if you are interested in this, this might also apply. So what we do with this activity is we have plastic teeth molds for everyone. And we pre-place melted chocolate in some of these teeth. We've learned with trial and error how to get the chocolate to stick in some of the grooves, where to put it to make it a little bit harder. And then you can really customize this and go into different types of dental tools, different careers doing different parts, what this all looks like. But ultimately, when they do this activity, they need to remove the chocolate from the teeth. Now, they need to do it, though, as if they were an oral health care provider. So we remind them, when you go to the dentist, they do not flip top your head open. Your mouth doesn't do that. So your mold needs to look like that. You need to keep your mold, in maybe looking at degrees and angles and not doing the flip top head, because some of them will try that. And then we've had students pick up the mold and turn it upside down to try to get sections of the teeth. And we do remind them that your dentist is never going to spin that dental chair upside down, even though it might be easier for them to clean part of your teeth. So we try to bring a little humor into this as well, and talk about what that, what that looks like. And, is this difficult? Is this hard? And then of course you can go into prevention, um, and talk a little bit about what that looks like with the and then the role of the hygienist, et cetera, et cetera. So you can take this activity, and do really a lot with it. When you are in a school setting, if you're there for, maybe they give you 30 minutes, maybe they give you more, maybe they give you less. This is very customizable, to be able to go in and meet the time frame that they allot for you. One of the things that we do after this activity is I bring with me toothbrushes and toothpaste for them. I have learned the hard way that the school prefers that you do not bring the flossers with the little points on the end, because they don't want students jabbing each other. So that's just a little tip. I learned that the hard way, to not bring those, but toothpaste and toothbrushes is always welcome. Okay, next slide, please. Okay, soap carving. So this is something that we do. I've actually never done this with middle school students. I only do this with my high school students. Not that we couldn't do it with younger, that's just what I've done. And I've done this live, and I have done this virtually when we have done our AHEC Search Academy. So again, I start the activity out with, I always do that same spiel that I told you in the beginning with the careers and what they look like and the salaries and all of that. And then this activity, I'm going to give them, it's usually Dove soap. Ivory works just as well. Sometimes that bar is curved. So I give them a bar of soap, and I just give them a couple of tools. And again, you can take this and go and expand any way you want. You can talk about reasons for grooves and fissures in the teeth, like in your molars. You can talk about breaking down food. You can talk about bacteria traps. You can talk about sealants. There's really a lot that you can do with this particular carving. One of the things that I like to point out to high school students when they're doing this, is I will bring up this activity, give them their supplies, and kind of introduce it. And I'll show you the slide that I use to introduce it in a minute. But one of the things that I tell students is, okay, you're going to take 8 to 10 minutes and you're going to carve me a tooth. A lot of them are a little hesitant. So I said, we're relaxed. This is a relaxed setting. You're just going to carve me a tooth. You can carve it and leave it in the bar of soap. You can carve it out. Just take the 8 to 10 minutes and carve me the tooth. And I do that for a reason, that I really emphasize that 8 to 10, because when you think about, tooth restoration and the amount of time that, an oral healthcare provider sits there and focuses on teeth, it's something where you need that skill set. You need to be able to focus. And there's always a percentage of students that can't fill the 8 to 10 minutes without themselves being distracted and doing something else. So for those that can, something like, okay, if you were able to focus on doing this, for a certain amount of time, this might be a good, career fit for you, giving them another encouragement, that this might be a career fit for you. And then certainly I talk a lot about artistry and dentistry. If you are somebody who enjoys sculpting in art class and you enjoy that attention to detail, after you remove that carie, when you're trying to reshape that filling, what does that look like? Is that fun for you? Do you enjoy that? Bringing that bit up as well. Nicole, can you give me the next slide? So this is what I show them when I'm introducing that, the soap carving project. I pull this slide up on, my big, large PowerPoint screen so that they can see it. And you can go over whatever parts of the tooth you want. or, just leave it very, very open. It just depends on my audience. Some of them I will say, just look at the pictures and just carve me the tooth, but really getting them to do the hands-on part of, moving your hands, trying to carve. What does this look like? And then talking a little bit about some of the dental schools in the past or even currently that still will ask you to do soap carving with the different dimensions and, making it more exact. But this is kind of our fun version of it. After I did this program, I did this up with kids in Tioga County up at Mansfield University, beginning of January. And this is the first time I have done it with that group of people. I had 4 sessions with about 20 people in each session. And coming in that day, had 1 student out of 80 who was thinking about oral health careers. We did this, and there were some people who were pretty fabulous at, doing some different oral health skills and carving this tooth. And I said, have you ever thought about oral health careers? Both of those students said no, they had never thought about it, but now they will. So I went, coming in 1 out of 80 and leaving 3 out of 80. It increased it. It was, it was something. And so I felt like that was really positive. Next slide, please. Okay, so this is my 3rd activity that I've done. This one I have done online, and it was something that we did. I mean, you could certainly do this live, but we just did it virtually. And what we did is we have gathered a bunch of providers together, various oral health care providers that helped us with search a couple years ago. And we had mailed these molds to each of the students that had registered. And then we had the providers speak about their day and their role and what they did. And then these teeth obviously have various problems. And I believe that night they talked about, somebody coming in from the beginning of the visit to the end of the visit. What does that look like if they had a root canal? And I forget what the other issue was that we looked at that. We looked that night, but you talk about from the patient entering the dental clinic to the testing and the diagnosis and what provider would do what task, where is their overlap. The providers that night talked about having independence, but this need for communication and, how the practice worked and the clinic worked. And I loved this activity for that reason, because you had all of the providers there to say, this is my role and I communicate it to this person, and this is their role and they communicate to this. And you saw the whole group aspect of patient care and the number of people that support and work together. And so this is activity number 3 that I have used. Again, I have only done this one with high school students. I have not done this with middle school students. And this one does require you grabbing local providers, but there again, I think that's fabulous if you can get your providers together to help you with these things. So those are the 3 activities that I use to get my middle school and high school students engaged and asking questions and thinking about oral health careers. Are there any questions that I can answer?
Thank you for sharing that. I'll keep an eye on our Q&A as well as our chat box. Definitely very encouraging and creative in how you're, giving those hands-on experiences. And, I encourage any of our attendees or participants to share maybe what they've done or, what they've saw in the past, so we can all learn from this experience.
Well, and it's one of those things too, where some of my counties are very rural, which means we don't have a large number of providers, and getting students to a clinic to be able to do hands-on activities in the clinic or see things in the clinic, sometimes that's a little bit more difficult. This is how we are creative in fixing it, so that hopefully we can sift out students and say, this group, like the 3 that were interested in that I spoke to, all have now job shadows lined up. but we didn't do 80 job shadows. We did 3. So, so that you can figure out who's really interested.
Thank you very much, Susan. That was really great. And again, tying all the different elements, it doesn't always have to be someone who's maybe very science oriented or that we think of sometimes of traditional healthcare providers, and tapping into that artistry and seeing how people connect that way, I think is really an interesting opportunity to consider. So I want to take the time now to pass things over to Dr. Lynn Williams, the executive director of the Southwest Pennsylvania AHEC, to talk about what's going on in this area in her part of the state. So go ahead, Dr. Williams.
Thank you so much. As we were talking with Nicole earlier, Susan and I work together a lot, and we do across the state. There's 7 regions of the AHECs across the state, and all of us do some kind of career foundation work with high school students. Given the COVID experience, we switched to doing this Search Academy of an online monthly opportunity for students. And now we're kind of resuming back to a lot of in-person work, but also trying to keep some of that virtual component to reach out to people who may not have the opportunity to come in person. Now, I sit in a different region than Susan because I'm in the metropolitan area of Pittsburgh. And so we have a lot of different high schools here that we can target for career exploration. And many of the high schools already have pretty well built out career exploration. So we have offered, you can switch to the next slide, since 2003, we've offered a in-person health career academy that's located at the University of Pittsburgh School of Medicine. And we accept up to 50 students every year to come explore health careers. I tried to do a count. We've had several people organize this work, and so trying to get a count of about how many students we've had. So close to 800 students over the last 20-some years. We look at just 9th and 10th graders. There is a former governor's school of excellence, or former governor's school here at the university, that would then take students who were current 10th or 11th graders. And so we kind of feed into that if they want to learn more about health careers. We started as a regional school of excellence funding us. And so what that did was it really kind of required us to look at students who were in gifted or advanced programming. And that wasn't necessarily always our targeted population, because we want to get this kind of idea of health careers out to all students. As Susan talked about that career path, and Nicole said, there may not be students who want to go on to post-secondary training. And so we want to be able to hit all students. And we've done that now that we're not tied to this specific grant support. I just throw that out to kind of help people think about, when you're seeking funding for different programming, you've got to look at what their criteria are as well. So we did pause in 2020. We did a virtual one in 2021 where we literally drove to everyone's house and dropped off a box of supplies. And then had them join online. And then we've been back since 2022. We had a huge drop in our attendance after that COVID. I think we had about 15 students the first year back and 38 last year. So we're hoping to increase back up to our 50 this year. You can go to the next slide, which I put in to give you a little overview of what a typical schedule looks like for this Health Career Academy. So the students are with us from 9 until 3 every day, and we try to throw in a variety of health careers. We ask all of our speakers to be very focused on hands-on activities, to limit their comments and talk to about 10 to 15 minutes about their career, why they like it, how do you prepare for it, what should you do as a student to get ready for it, and then engage them in hands-on activities. Now, we're really lucky where we are that the School of Medicine, which is one of our long-term partners with AHEC, hosts the academy in terms of providing us space for this in classroom space. And it is literally right across the street from the Pitt School of Dental Medicine. And so we just walk the students over. And then they have the opportunity to meet up and learn from people at that school. So next slide will I was thinking through what are some of those key points of being able to run this academy and that partnership with these schools in the university is really important. What's been very important too is having a faculty champion at the school, someone who's passionate about that recruitment of the next group of students. And we've often used the pediatric dentistry interest group. So those are students who are kind of feeling, dental students who are thinking that they're going to be going into pediatric dentistry, but a lot of other students will often get involved too. So there's usually probably 6 to 8 dental students who will participate with our career academy. And we start off with, the introduction to dental medicine. And every year it differs depending on the students or depending on the faculty champion, what they want to do. They've done tours of the dental school so they can see all the different components. We are often working in one of the simulation labs. And so this photo is, what the current simulation lab looks like at the School of Dental Medicine. And we do a lot of different hands-on activities. So if you go to the next slide, I just threw in some slides of, students over the years doing different activities. This one was the school had provided each student with a little kind of like a medicine cup that was filled and had a tooth in it, and that tooth had a cavity, and they were doing the dental like curing of the cavity, the resin material. So they all got to do that, and then they walked out of that out of the experience with that tooth. As Susan also alluded to, one of the fun things that happens every year for these students is that the school provides them with a little bag of toothbrush, toothpaste, and we have given them the floss, Susan. So, but the students actually really enjoy that, and they'll trade around what color toothbrush they're taking home. So you can go to the next slide as well. So just some more photos. This slide and I think the next slide as well showed that this past year, if you go to the next slide, the students were provided with this little kind of rubber simulation that had different kinds of teeth issues, and decay and stuff, and we're able to do a little bit of drilling to try to kind of play with the instruments and learn. And as you can see, this is one of the dental students who's talking to our students and demonstrating how to do some of this. And you could go on to the next slide. And then part of being a dentist is that ability to work kind of backwards, right? The mirror image aspect of looking in the mouth and using that mirror. So the students all do some practice of looking in a mirror and trying to complete a maze as one of those examples of some of the skill sets. So trying to build in different skill sets that are used by a dentist as part of that encouragement to think about this career. You can go to the next slide. And then I threw in some of the other things. So, we spend a morning, it's usually a morning, or we spend an afternoon at the dental school. And then we have a variety of other different careers. So just some fun photos of different things. The day that we do the physician day, this is one of our emergency medicine physicians who comes up, and all the students learn how to intubate a mannequin, which is either fun for them or frustrating when they have trouble with it. But some great preceptors. You can do the next slide. We have athletic trainers come in, and they all get the opportunity to wrap a wrist or wrap an ankle and learn that kind of thing. Next slide. We have in our medical day, this is actually the medical students ophthalmology interest group. That group will come and work with our high school students and show them different things about examining an eye. And so they get the chance to look at each other's eyeballs with the slit lamp. And the next slide. Occupational therapy. So we often walk down to the occupational therapy school, where they engage with a variety of different objects that are created by occupational therapists to help patients who might have a disability or might need some strengthening exercises, but they always enjoy different things like that. In the next slide. And then our physician assistant day that we have with them, we do 2 different kind of hands-on activities. One is learning how to suture. And so they practice practice sewing up an incision within a pig's foot. And then we do a sheep heart dissection and talk about cardiology, blood flow, diseases related to heart issues, things like that. So, next slide. So I went through all of my, tried to go through surveys that we've done in the past. We have not, sadly, have not gotten great follow-up with all of our attendees, which is something that we'd love to be doing more. But I often tell our faculty at the School of Medicine, and I know I've told Helen from PCOH, that we ask students, just like Susan did, at the beginning of the Health Career Academy, what do you want to be when you grow up, right? And I've now had them record that on their intake forms. And I would say with our Career Academy, it is 90 to 95% of them walk in Monday morning wanting to be a doctor. And most of that, I think, that's the career they hear so much about when you talk about health careers, right? It's like, I'm going to be a doctor or a nurse. And so most of them will indicate that that's their plans. By Friday afternoon, I ask them again, what are you going to be when you grow up, right? And I do see a shift in definitely much more interest in dental health because they've been exposed to it, a lot of them for really the first time, other than their own personal dentist. But my favorite is that most of them will say, I want to be a doctor or a dentist, a doctor or a PA, a doctor or PT, right? They can't quite give that up yet, but they're starting to think about it more. So this attendee did say that they were, their heart was set on attending dental school at Pitt after going to our academy, and that following that they had shadowed 2 local dentists to explore this later. Next slide. This one said that before she went to our Health Career Academy, she didn't have a clue about what to do, and it opened a lot of doors. For example, I was interested by the dental school visit, but I had never considered being a dentist before that point. Sadly, she's now an OB/GYN physician in Boston. So that one didn't stick, right? But she thought about it. Next one. This one, however, did stick, right? So he's now an orthodontist in our region. And the next one. I'm showing you my positive, right? And this one as well is a 2010 graduate who is a DMD now working in the Maryland area. So next slide. So we are coming up on preparing for our current 2025 Health Career Academy, which will be, we're often the 2nd or 3rd week of July. And so we just put those up live on our website for people to start being able to apply. I'm in discussion with the dental school. Some of the things that, make it a little bit challenging is when you have changeover of faculty. Currently, we have changeover administrators, but I do have a wonderful dentist at the university on my AHEC board, and she's been wonderful about trying to help us keep that relationship and find that time space that the students can explore that. So next slide. I don't know if I have another one.
That is the end.
I think that's the end of it. Yeah.
Oh, well, Dr. Williams, thank you. I think one thing that you and both Susan highlighted really, really well, not just the creativity, but the impact of what you're doing and how that exposure really can change minds. And I think one of the other things to continue to recognize the positives is even if maybe we aren't able to capture as many new possible, practitioners or future practitioners, you're still providing opportunities to deliver oral health education and help, our young people understand the importance of what they're doing or when they're in that dental chair. Or even for those who go on to pursue other avenues of healthcare, they've still been exposed and, have that connection to oral health that we hope they will take with them because, we don't want to keep it siloed, whether that's through Dr. And or, just in how we're experiencing our healthcare. So I do want to just again say thank you to our area health education centers across the state. If you're unfamiliar with what they do, where they are, or what's happening in your region, this slide will be included, and all of the links that you see in blue are active. So find your county, check out, see what they're doing, get involved, and, kind of see what they're doing around dental. Now are going to move into, some panelist discussion. I know I want to pick your brains. We've had some questions come through the chat as well. And, I do want to mention a comment here from Natalia, who shared that they have middle school students that come into the clinic to place sealants on typodonts. And, that's a partnership with Montgomery County Community College. So I think that's, a really cool opportunity. And it kind of leads me into a question that I have. Susan, Dr. Williams, you are both in very different parts of the state. North Central Pennsylvania and Southwest Pennsylvania, very different. So when you're looking at putting these programs together or working with students in your region, what are some factors or, regional things that you consider when you're putting this type of program together? And Susan, you can go ahead and start, or Dr. Williams, doesn't matter.
I'll start. So regionally, one of the things that happened this year in Tioga County, we knew that Commonwealth Mansfield University was going to put on several days for career exploration for health careers for high school students. Their format was going to be all the students come and hear 40-minute, maybe 20 to 30-minute talks about lots of health careers. And then they are going to bring them back to different sessions based on their interest, where they spend more like an hour and a half to 2 hours doing lots of hands-on things in those health careers. In this part of the state, it is very hard to get oral healthcare providers to commit to 2 days of not practicing. So, certainly we wanted oral health to be provided, to be offered in that, and Commonwealth Mansfield was very open to this. Their university does not offer any oral health care professions at all, but certainly wanted us to participate in that room in some way. So I took on the overview, the little 20-minute session in January, where I had them do soap carving. Maybe I had 30 minutes, but whatever it was, the little session is something that I could do as AHEC, so that when it comes to the day where they need the oral healthcare providers to have a much larger chunk of time off, they will do that part, and they will go ahead and do more hands-on activities. Certainly more in depth than what I did, but being able to partner with regional players and saying, okay, if you can't take 2 days off to do this, let me jump in and do the overview. That's something that's very helpful. And then knowing your audience. There are certain counties that I have where different percentages of students will know various things about health careers. I have percentages of students who only know of oral health careers because of the Smile Bus. They qualify for that. I have students who don't make it in the Smile Bus group, but don't have oral health care providers. And then I have a very larger section of people who have really great teeth. And so they get preventative care. So they meet a hygienist and then they leave. But we don't always, in my area, like my daughter and I will go next week to have our preventative work done. We may or may not see the dentist at that appointment to, come in and check after the hygienist, just because of the number of dentists that we have seen leave the county or retire or whatever in the last so many years. That's not always something that can happen. So when we talk about oral health careers, you don't know what it is if you can't see it. So a lot of these kids really, to understand that they only know what a hygienist is. If they've never needed a filling, they don't know what a dental assistant or an EFTA is for sure. So really knowing to take the time to break down the careers and make the time to do that and explain it.
Dr. Williams, I know you were answering some questions in the chat. Anything that you want to, speak to regarding, that regional consideration when you're putting these type of programs together?
Yeah. Well, I think my region, as I kind of mentioned before, is just we're flush with universities here in the Southwest region. So we have a lot of different options. Uh, well, in oral health, we have the university, so that's been wonderful. In the past, we used to provide a lot of transportation to our outlying counties to bring the students in because they don't have that opportunity quite so much, but cost has really become a barrier to that. So that's been a bit of a challenge to really try to find a way to reach our outlying students quite as much, and that's why we've, tried to do some of this virtual work. But, we did that since COVID, really worked on that, having that virtual online platform for students. And we weren't getting great, real response to that, or students applying and not showing up for a variety of different reasons, And so it does make you kind of wonder what is the best way to really get out and reach some of the students who don't have the same access as students in Allegheny County might have. Is something we're still trying to work through. And I think that's why, Susan's pursued a lot of different kinds of activities to try to hit those areas specifically.
And thank you all. You guys are answering the questions through the chat as they come up. But I do want to highlight Donna Murray had put a question in the chat about tuition for the Health Career Scholars Academy, which Dr. Williams answered. And you mentioned even having scholarship opportunities to help the students participate in these types of programs.
I think if I can just say quickly, because the University of Pittsburgh runs the Health Careers Scholars Academy, which was the regional school of the governor's school previously. It is probably on its last year because the coordinator is retiring. It's a very intensive 4-week residential program and has a high tuition because they're providing housing and food for them. But they do a lot of oral health work as well in that 4-week program. So that's available for any students actually across the country, and they've gotten students from Canada and France come as well. So yeah.
And if anybody is planning health careers academies, you can contact your local AHEC region and we will help you promote them with, the context that we have within schools. What we have found with working with schools is there is high turnover in a lot of schools as well. And so you think you have the correct contact, and then the next year it's different. And then, sometimes you get it, to multiple people to get in the door. So we will always help promote some of those. I know I have done that in my region. There's a nice one at Penn College of Technology that happens every summer. So we do try to promote these if you have them available. So, please let us know if you have anything coming up, and we'll see how we can partner.
Thought I saw a hand raised in the audience. I just want to double check. If there are any questions you don't want to type in the chat, or if you want to just offer something, please feel free. We can unmute you and really open up this discussion as we move towards the end of our session today. But I do want to thank our speakers. And just kind of, again, I don't want to minimize or, take away any of the light of what they're doing, because it is so important. But our goal today really was to encourage each of you to find a way to connect in that community to foster interest. And Dr. Williams and Susan really spoke about how they do that. I want to make sure that we understand it doesn't have to necessarily be a time-intensive way. It can be something that you do as an individual provider, or just somebody who is genuinely interested in promoting oral health careers. And it takes 3 easy steps that each of our speakers spoke about, of developing partnerships, making those connections, seeing who is in your area. And I do also want to point out something that came through Q&A, reaching out if there's a local HOSA, a Penn HOSA, which is a Health Occupation Students of America group. So maybe people who already have identified some interest but don't know about those dental options and just need educated. As well as, Dr. Mancini, I noticed he came up in the Q&A as well, reaching out to the dental association, finding a way to connect with your local dental association group or other professional groups to speak with providers in the area, see who's available. Again, sharing your experience, like Susan spoke about, a lot of our experience is sitting in that dental chair. We don't know what it's like to be on the other side of that. And the hands-on activities are really great opportunities for individuals to dip their toe in or kind of experience the other side of that. But I think there is something very impactful about being able to share passion, share success when you've been in a career field for so long. So again, just something else I think you can do, and it doesn't have to happen directly at a career fair across the table with papers. That can happen in the office or, in the community, because you are recognized for that role. So, and lastly, again, we had a nice shout out about the materials that the Pennsylvania Coalition for Oral Health does offer on our website. Our goal is to tap into what our generation, of students want, and they want information. They want to find a place where they can start that Google search or, find more information to build the correct career path that they're hoping for. And what we try and do is give them that piece of paper, or give those parents that piece of paper so they have a jumping off point to do that. We also do that to support anyone who is speaking about careers, to not reinvent the wheel. Say, we have it, just take it, share it, because they're going to remember the story and the experience they had with you when they look at that piece of paper and keep that career alive. So again, please feel free to check out our website, request those materials, or download them. And finally, I do just kind of want to highlight, we've recognized that we've been increasing partnerships, and because the dental need is becoming more well-known and not as isolated from the general healthcare shortage that we're experiencing in the state, PCOH has been called upon by schools and community groups that are having career fairs or those exploration events to represent dental. And of course, we want to be in every setting that we can, but we can't meet that need on our own. And we understand that we need someone from the community to really do that and have that impact. So we've organized a speakers bureau, and it is made up of all manners of dental professionals across the state. And the role of this is when we get a request from a school, that we can connect with somebody in that area who can be present, who can do those simple things that we talked about, and be a face or be an opportunity even for further mentorship to keep that pursuit alive for any individual who is interested, or maybe finding people who didn't know they were interested until then. So there's information there on the screen about, what we offer to help with that. Again, our role as a coalition is to make connections and see these things be successful. So if you are interested in joining our Speakers Bureau or getting involved in anything else that PCOH may be working on, I ask that you please reach out to us. All of our connection information is on the slide, and I'll include that in our follow-up, as well as the information for our speakers today and the various regional AHECs. So I just want to close out by saying thank you to Susan Gage from North Central AHEC and Dr. Lynn Williams from Southwest AHEC. Thank you all for joining us, and I really hope that this inspires you to do some more outreach in your own community. Thank you.